the respiratory department, and we're going over oxygen delivery devices and sensors to check for stats. So first thing is our nasal cannula. It can go from 1 liter to 6 liters. You can have humidity on that. Anything above 6 liters, you're going to want to switch out to a different device. Our reservoir cannulas, oxymask or oxymizer, they can also go from 1 liters to 15 liters or more. You may not have any kind of humidity on these whatsoever. Simple masks, they mainly use those in surgeries, but if they ever come up to your floor and a patient is on a simple mask, we ask that you throw that away and get a different delivery device. They have to start at least 6 liters per minute, so it's just easier to put it on a different device. Non-rebreather masks, they can go from 10 to 15 liters or more. The most important thing to remember on that is when your patient is breathing, that bag always needs to be inflated. So if they're breathing too deeply and that bag is collapsing with their breath, then you want to turn that flow up, because that just means that you're not giving them enough flow. You do not want to use humidity on the non-rebreather mask, and you really don't want to go below 10 liters per minute. Veni masks or Venturi masks, we mainly use these with our COPD patients who really need a precise amount of oxygen, and then we use it to transport our trach patients. You cannot use humidity with the Venturi mask, and the thing to remember about that is each of these valves has not only a liter flow, but an FiO2 on there. The liter flow has to match the valve here, otherwise you won't get precise liter flow. So for instance, if you want a FiO2 of 30%, this has to match, and then it has to be on 4 liters. If you tend to titrate this up or down, you're gonna wanna change not only your valve, but you also have to change your liter flow. Again, you don't see them too often on the floors, but every now and then they do show up. Airvos are high flow heated humidity. They can go pretty low, up to 60 liters per minute, up to 100% FiO2. Humidity obviously has to be used with this. When you titrate it, on the machine is a play button here. You push this play button, that lights up your screen, and then you turn the flow valve. The numbers on the flow don't matter. You use that to increase or decrease your FiO2. And there's different ways to do that. Nasal cannula, we have mask options, and we have trach options. Again, respiratory is always there to help. We can help you no matter what. Just give us a call, we're happy to help. The other big thing we're talking about is SpO2 sensors. We see a lot of these just placed on random body parts, a finger probe on the forehead, and you actually do not get a good oxygen saturation. Based on the NELCOR website, you can actually get 50% lower or 30% higher reading, which when you have these patients that are kind of on the edge, it's real important that we have it in the right spot. Finger probes, if they have fake nail polish, you do need to get that nail polish off using nail polish remover. You want the red light on top to match the bottom of the sensor with a finger probe. You can use a forehead probe. Forehead probe gets placed on the forehead. It has to be moved every 8 hours, otherwise it can cause burns. We have infant pulse oxes for children, pediatrics, sometimes that can work on our patients. You can also use it on their big toes. We have nasal probes and we have ear probes, so just make sure you're using the appropriate probe for the appropriate body part, otherwise you're not getting an accurate signal. And the other thing we talked about was tanks, tank safety. Just make sure they're in the appropriate tank holder. Don't just chuck it on a bed when you're trying to transport. I see them standing up in the middle of the room sometimes. Just make sure you lay it on the side so you can get a holder and put them in the right place